And also we're going to start recording. And we're gonna drop that in the chat in 3, 2, 1, send. Wow. Yes, we've got people from everywhere, all different kinds of time zones. It's morning, it's afternoon, it's evening. And make sure you share what you're excited about learning in today's session. Excited to know more about everything. Hearing stories from on the ground. All right, wonderful. I am loving all this energy and excitement that y'all are bringing into the room. Before we jump into the conversation, I want to cover just a few housekeeping items. Please make sure you keep yourself muted while speakers are talking to avoid audio interference, and you can feel free to drop your questions in the chat. For our speakers, we'll be covering questions from the audience in the final 10 to 15 minutes of the panel discussion. So we've taken some steps to make sure that this is a safe space, but there's always a chance that we could have online trolls who interfere with the event. If that happens, my colleague Lindsay will share this image on her screen until the person has been removed from the meeting. Great. All right, let's get started. I will let each panelist briefly introduce themselves, their work, and their background. Representative Herod has a time constraint, so I will start by addressing the first question to her and then open up the discussion to all the panelists. First, we have Dr. Annemarie Kamuyu, the Operations Manager of the National Gay and Lesbian Human Rights Commission. Annemarie, I believe you're muted.
Hi, can you hear me now?
Perfect.
Okay, my name is Annemarie Kamuyu, and I serve the National Gay and Lesbian Human Rights Commission, and I serve as Operations Manager. My background is in business administration and finance. However, as a sexual minority, I don't have the luxury of shame. I have to continue to agitate and in the spaces that I occupy in reference to my lived reality. And I thank you so much for giving us this opportunity to engage in this forum. Thank you.
Thank you, thank you. We have Luisa Orza next, the HIV and Gender Technical Lead from Frontline AIDS.
Hi everyone, so much for inviting me to be here today. My name is Luisa Orza. I use the pronouns she, her, and as Giovanna just said, I represent Frontline AIDS, where I'm the Gender Technical Lead. I've been working in the global HIV response on gender and sexual and reproductive health and rights for coming up for 20 years. In that field of work, working with marginalized women and girls in their diversity, LGBTQ plus communities, and other marginalized communities like people who use drugs, sex workers, and other vulnerable communities. So, thank you.
Thank you so much and welcome, Luisa. We also have Grace Kamau, who is the Regional Coordinator of the African Sex Workers Alliance.
Good morning, good afternoon, everybody. My name is Grace Kamau. I work for the African Sex Workers Alliance as the Regional Coordinator. I identify as a female sex worker, and African Sex Workers Alliance is a continental alliance working in 34 African countries. And our work is to amplify the voices of sex workers to be able to occupy spaces and also be able to lobby for decriminalization of sex workers. And excited to be part of this conversation, and we'll talk more. Thank you.
Yes, Grace. Yes. We'll now hear from Colorado State Representative Leslie Herod.
Hello, everyone. I am State Representative Leslie Harrod. So good to be here with you all this morning. And I'm really annoyed with my staff for scheduling me back to back because I would love to be here for this panel. You have so many amazing experts here. And yeah, shout out to having an actual sex worker in the conversation talking about what's going on in real people's lives. Hello, we need more of that. And so I just, for those who don't know me, I'm the first African-American queer person to hold elected office in Colorado, no longer the last, because, you know, we lift as we climb. That's what we do as women and people who identify as women. So I'm really excited to be able to do that work. And so background, my mom was in the military. She served 20 years in the Army, if you could believe that. So funny. This little story, she's from Oakland, California, didn't want me to go to Berkeley because she thought it would turn me gay. So I went to Boulder and I got my first girlfriend. So yay on that. But learned a lot about activism there and really have used that work as a youth leader to be an elected official here today. So I look forward to the conversation, the questions, and I will check out your recording later because I would love to hear what other folks have to say. So thanks for having me.
Ow, ow, yes, I'm so excited for this panel, all of this energy. Thank you for being here and coming as you are. I'm going to direct the first question to you, Representative Harrod. What are some of the unique barriers that the LGBTQ plus community faces in accessing reproductive health care?
Yeah, well, and I think we have other experts too that can really dig in on this. But to be quite honest, it's one, we don't have physicians, nurses, medical professionals who actually understand what it's like to be queer. And they're not taught in medical school the unique differences that we have in our reproductive health or that we need. And the schools that do, it's like an elective, right? Which is absurd. And so one, I think that I should say my mom was in the Army, was an OBGYN, okay? And so my brother is also anesthesiologist. And so the number one important thing is that you can have honest conversations with your medical professional that you know will be kept confidential, that you know will be respected, and that you know you'll be getting care that is informed. And right now, that's not how it is blanketly, and that's something that needs to change. And so, it's still the same way. Every time I go check in with a new doctor, it's like, are you pregnant? Are you married? Who's your husband or your boyfriend? And I'm like, listen, like it says queer all over the dang on sheets, but you're not looking at that and not applying that to my life. And so I think just being able to have those conversations is something that is of the utmost importance. And so we've come a long way, I think, in certain parts of this country and making sure that folks are a little bit more informed, but it's not enough. And we have a lot more work to do. Additionally, we need to make sure that there's comprehensive sex ed taught in our classrooms, but also to everyone in our school buildings who is offering advice and support to our young people, because they are falling short as well. If you are in a relationship that looks different, you should be able to get care from your school nurse or your school health center, school-based health center that is also informed. So those are things that we're working on. In Colorado, comprehensive sex ed is now mandated. And man, if you could hear those conversations in committee where people were thinking what we were teaching our kids, it's just so interesting, but so not factual. But I'm glad that we're doing that here in Colorado. We've got a lot more work to do.
Yes, thank you. And I really appreciate you offering some personal examples of what that looks like. Yeah. Grace, do you think that you could expand on that a little bit? Do you have anything you'd like to add?
Okay, so I just want to mention that even in this conversation, I want to start by saying that the title says LGBTQ plus communities, and there's no mention of sex workers. So that's the first issue. And so I also want to say that we have seen the issue of sex workers who are murdered in Atlanta, Georgia, who are in the brothel. And we as sex workers, it's very sad to see that even in 21st century, people still don't understand that there are women who have chosen sex work to be work. So we need to see people rallying behind the sex work movement and coming out and supporting us, because we as women have chosen sex work as work. I also want to talk about barriers, about segregation. For us as female sex workers, we have seen healthcare being segregated, and the entry point that most of the people want to offer services for sex workers is through HIV and STI treatments. And you find that most of us sex workers are not comfortable to go to a different clinic to go get family planning methods. And the segregation, the fact that people see HIV as the first as the first need of sex workers, makes even sex workers not even prioritize SRHR as one of the issues. And for us women, even for me as a sex worker, I want to give an example that I just gave birth to a baby 5 months old, and it was very difficult even to access healthcare services, because one of the questions you'd be asked is, where is your partner? You have multiple partners. Actually, when I got pregnant, I couldn't even tell who the baby belonged to. So it is a catch-22, because once you go to the clinic, you asked for your partner. You don't know who your partner is. So for us sex workers, SRHR becomes a less option because it is not even prioritized. There's not even comprehensive package about the needs of sex workers. As the African Sex Workers Alliance, we are looking at a research where we can give even donors directions on what is a comprehensive package when it comes to SRHR for sex workers. What are the needs of sex workers? We know most of the highest percentage of sex workers are female sex workers. We are giving back, but SRHR is not a priority to sex workers. I also want to mention that there is a lot of intersectionality between sex workers. When you look at female sex workers, transgender sex workers, even it becomes even harder to transgender sex workers to access services because the stigma is even higher. So we have seen healthcare providers and also even donors, even people who give money, even healthcare providers shying away from giving SRHR to sex workers because they will say, your priorities is HIV and STI. You come with recurrent STIs, but pregnancy and everything, you can go to mainstream healthcare services. So communities being at the center of setting the agenda, and communities telling people what our needs are, other than priorities being set by other people. Yeah.
Yes.
Thank you.
No, thank you. Thank you for raising awareness for those unmet needs and sharing your own personal experience. I am going to direct another question to you, Representative Herod. How has the COVID-19 pandemic impacted your work and programs?
Yeah, I mean, the pandemic has changed everything for all of us. We have had to really reshift our focus to ensuring folks are getting access to care who are not necessarily going to the ER or going to their doctor's visits for fear of getting COVID. And so what we are mostly dealing with is like this backlog, right, of folks who have medical needs that have been unmet. So there's a lot of work that we need to do. But additionally, there's some things that are still happening, right? Like there's still people who are still working. There are folks who are still, essential workers still working. There's still folks who are, needing access to reproductive health care, and they're not getting it. And so I don't honestly think that we have been doing enough in this country or any state in ensuring that we are providing healthcare outside of COVID healthcare to folks who are still working and who need that care, and our young folks. I mean, if you're in your house, it doesn't mean that you don't need access to reproductive healthcare, right? And so those are things that we really need to work on, I believe. And I honestly just don't think we're doing enough. We're also not doing enough to ensure that folks who aren't as seen, as visible in our communities are getting the help they need, right? And so those are things that we're trying to work to identify as well.
Absolutely. The idea is that we work to make sure we have public health care that everyone has access to, and we don't have to wait for another pandemic
Yeah, and the one thing that I am working on too is making sure that that the vaccine is equitably distributed, which we are not doing well. So we keep pushing on that, but it's not only in this country, but making sure that we are providing resources to other countries, especially those that have communities of marginalized communities within them, right? That they also have access to the vaccine, and that we're providing our resources for those efforts. And I'm proud to say that the last Recovery Act did include that funding.
Absolutely. And I do know that you have to go. So I'm
Yes.
going to circle back to that question for all of the panelists. I want to ask you one more question though.
Sure.
Is, what progress do you see as possible for the LGBTQ plus reproductive health and rights over the next couple of years?
Yeah, I mean, I think we also need more queer docs, right? Like, and more queer physicians and medical service providers. You know, when I was in Amsterdam, I went and visited on this, you know, it was like a professional thing. And I was like, well, we're not going to have this professional conversation in Amsterdam about housing if we're not also going to have a conversation about sex work. So I led our delegation to have that conversation and to really try to start to understand the different ways of legalization versus decriminalization when it comes to sex work. And that is a conversation that is now ongoing, but I think some of our more liberal cities should lead the charge on, including Denver, San Francisco, and others. I think Atlanta is a part of that now as well. So we have a lot of opportunity there. One thing that I want to mention before I jump off is how harmful the global gag rule is and my experience there. So for my mom as an OBGYN military officer, we lived overseas often. And one thing I'll always remember is sitting in her exam or her waiting room, being homesick from school and watching in Korea and watching women come in and out and leave like terrified and broken and crying. And I'm like, what is going on? And my mom said, because of the global gag rule, and because we're not providing funding to these clinics off base, soldiers, women, as well as folks who are non-military, are having to be subjected to dangerous reproductive health care, dangerous access to abortions, and they are dying or they are losing their ability to ever have children or start a family in the future if that's what they want to do. And so this is so harmful, not only for folks who are in other countries, right, who are not getting access to that care and those dollars, but to us too, right, who are overseas, who are not getting access to good reproductive care. So those are, it's detrimental. It's detrimental, it's dangerous, and it's deadly. And we've got to change that. And then I think we have to really work to make sure that our elected officials and those who they appoint are not Puritans. People are having sex. People are utilizing things. And like, we have to make sure that we have care that reflects the realities in our society and not putting some Puritan culture or Puritan values on our dollars, on the way that we deliver care and our humanity, right? What we're doing for other folks in our country and elsewhere. So we need to get to work. We need to start asking the hard questions of our elected officials about how they plan to deliver services, deliver care, what they think about people having access to care, not regardless of who they are, but because of who they are. And that's a lot of work that we still need to do. So thanks for having me.
Thank you so much for touching on the global gag rule and offering all of these insightful observations. And it's so wonderful to be here and be able to host this panel with you. Thank you so much for your time and all your passion. We really appreciate it.
Thank you. Talk soon. Bye.
And Annemarie and Luisa, if you'd also like to share how the COVID-19 pandemic has impacted your work and your programs, that'd be wonderful.
Can you hear me?
Yes.
Okay. The LGBT community has especially suffered through the pandemic with homelessness, mental wellness. There's been a lot of IPV because of partners being put up together for long periods of time and they fight. And the commission has been getting so many cases of internal partner violence. We've also gotten joblessness, mental wellness issues. We had people committing suicide because of just hopelessness. Such severe economic indignity. This is what my community suffers right now. And then add to that, no access to SRHR services because most of our sensitized centers have been closed because of GGR. And it goes on and on and on. So that means if the centers are closed, our people don't get subsidized care. That means MSM and gay community don't have access to ARVs. They don't have access to condoms, lubricants, and then there are more infections, reinfections. Our community consults have just shown a rise in negative trends in violations by state actors in my country, from our sex workers to IV drug users to sex and gender minorities. So basically, the community that I serve has really suffered setback after setback after setback. Not to mention lack of PPEs. And then the global gag rule also meant that the government parastatals that serve these communities that I serve also did not have quite enough medication and didn't have condoms and didn't have lubricants and didn't have all of these things that they usually have for key populations because our borders were closed for months. And then not to mention the diaspora was also closed for months. So our communities continue to suffer the brunt of this economic indignity and the economic downturn in the country. Then we also had a lot of relocations stemming from transphobia, homophobia. We also had to give food care packages and sanitary towels to our LBQ, ITGNC persons because of the indignity. Then we had shrinking of safe spaces, LGBTQ spaces, because funding partners had to take care of their own citizenry. So it's just been a whole thing, right? And then our LBQ, GNC citizenry did not have access to prenatal, postnatal care. They had, some of them were suffering from unsafe abortions, like my sister Grace was talking about. I mean, it just goes on and on and on and on, and then we have our sex workers dying of COVID because we had some porous borders, and as a part of the key populations, in fact, they've really, really suffered post-COVID because of exposure, and they still have to work. And then we had the dawn to dusk curfew, and then our internal borders were closed. So our sex workers really suffered in that time because when do you work? When there's a dusk to dawn curfew. And then when you have in porous borders where people from some East African countries who are coming in without PPEs, they put our sex workers in danger. And so basically there were these countless deaths from COVID were unnecessary. But people have to work, people have to eat. Our community members have nowhere to go. Where do they go? We don't have enough spaces to host. We don't have enough safe houses. Our funding partners have to take care of their own citizens before they take care of everybody else. So we have all of this. So that basically that's a ripple effect of COVID. And then not to mention the indignity of arbitrary arrests from our state actors, from the police, prosecutorial misconduct, from overcharging on discriminatory penal codes in the Kenyan Constitution. So we've suffered a lot. Our sex workers get arrested for nothing. We don't. If you charge them for loitering, but don't overcharge and lock them up for days, what are their children going to eat? Our LGBTQ refugees in our camps right now, there's so many, and the UNHCR doesn't have anywhere to put them because they need relocation to third country, but the diaspora is all closed. Europe, America, Canada, they've got nowhere to go. So this is our lived reality with the global gag rule post-COVID. And I don't know, I hope it gets better with Biden.
Yeah, absolutely.
Yeah.
And Luisa, I'd like to invite you to answer that question. And if Grace, you'd like to expand on it directly from the experience of a sex worker, that'd be wonderful.
Okay, so yeah, thanks so much, Annemarie. And I concur with everything. I'll try not to repeat what Annemarie said. And I want to talk about the changing dynamics of sex work. So we've seen now sex workers changing dynamics. Now sex workers are not going to the streets, they are not going to the bars. And if sex workers are going to the bars, they are very crowded. And I want to support what Annemarie said, that a lot of sex workers are dying from COVID because you have to get food, you have to make money because that's the work that we do. So we have seen deaths of sex workers going up due to COVID and going to crowded places because most of the bars and most of the places have been closed down. And when you look at the changing dynamics of sex work, we've seen now sex workers doing a lot of sex work online. And we've seen a lot of digital insecurity where sex workers are being dragged and later you're getting sex workers being killed. There's a lot of digital insecurity that sex workers are reporting. And I also want to acknowledge that most of my community members have never got an opportunity, mostly in Africa, to go to school. And so digital literacy is something new to us. And so there's a lot of challenge even to use digital, to go digital to do sex work. So there's a lot of capacity gaps when it comes to using digital, and that is what everybody's moving to. So there's challenge among our communities, and because we are moving to that, so sex workers are disadvantaged on that. So I also want to talk about issues of violence. A lot of research, even us as the African Sex Workers Alliance did a survey through our communities. And it's very sad that we have seen the increase of violence going to 40% due to COVID. This is because now sex workers have moved from the urban areas to the rural areas. Why to the rural areas? Because people are running away from paying household rents. People are running away from paying, but because there's no money, people are trying to get simple life. So people are moving away to the rural areas. And so we have seen now sex workers reporting there's a lot of migration among sex workers. And even HIV and infections are being reported outside the urban areas where we used to see a lot of infections around the urban areas. Now, infection rates have gone to the rural areas, and it's very sad that our programming earlier didn't look at the rural areas. How do we program on those areas? And it's sad that we are seeing the gains that we have gained through the years, over the years, and trying to even bring in infections down. It's sad that we might even see a spike of infections because we are not even ready. We don't have even resources to go and program in the rural areas. But how do we synergize? Because there's a lot of intersectionality among sex workers, among drug users, among LGBTI communities. All these issues are being faced by all key population. And to add more into it is the criminalization of the key population, the LGBTI sex workers, drug users. We are all criminalized. So all these issues are cross-cutting. How do we synergize and make sure that we look at the intersectionality amongst us, key population, so that when we are programming, we can be able to look at programs that can look at all the key population with the intersectionalities that we have. And basically, that's all I had to add. Thank you.
Thank you so much. I'm already just learning so much. I'd like to direct a question to you, Luisa. How has the access to reproductive healthcare worsened in the communities that you serve and research as a result of the barriers imposed by the Trump administration and the global gag rule?
Thanks, Ivana. And thank you so much, Annemarie and Grace. Everything you've said resonates so strongly with the work that I've been doing. And of course, Grace is one of Frontline Aid's partners. We do a lot of work with the network. On the global gag rule, in particular, I mean, I think one of the important things to say, of course, is that Trump wasn't the original author of the global gag rule. It was there in previous administrations, but you know, he really took it and ran with it, didn't he? So seeing, you know, the expansion of the global gag rule under the Trump administration, and particularly how, you know, how it applied to just a vast range of health funding, including funding for HIV through PEPFAR. We saw myriad impacts from that. Obviously, the most direct one in some ways was loss of funding, and to Frontline AIDS, we were non-compliant with the global gag rule, which automatically meant that we lost all of our USAID funding, most of which was for LGBT programming, actually, and programming for men who have sex with men in areas that are extremely hard to work in, such as the Middle East and North Africa region, where we were really one of the only organizations doing that work sort of back at quite a long time. So there were those really obvious and direct impacts. But I think that there were a lot of very sort of subtle and nuanced impacts of the global gag rule as well. So especially where in the HIV response and in the SRHR field in general, we've been really working towards and moving towards an evidence-based integrated approach around HIV and SRHR, seeing HIV very much as a part of a comprehensive SRHR package, understanding the benefits of like having integrated services, recognizing the linkages. As soon as you then sort of disrupt one part of that comprehensive package, the whole of the rest of it sort of begins to fracture or fragment as well. So I think that's one of the things that we really saw happening under the most recent iteration of the global gag rule, where instead of both kind of programs, organizations, civil society working together, you know, all of that kind of joined up mechanism began to fragment in different ways. So unexpected results, such as men who have sex with men's drop-in centers in areas where you have high, you know, you're working with basically a criminalized community, very high rates of stigma and discrimination, of a community that fears to access public health services for the reasons that we talked about earlier in this session, the stigma and discrimination, the denial of services that they may receive in those spaces. You know, all of those things then come together to then impact on that community. So we saw drop-in centers for men who have sex with men closing because they were satellite services from an integrated HIV SRHR provider that lost half of its funding because of the restrictions or because of the non-compliance with the global gag rule. Or we saw, you know, programs being shifted from one, you know, from one supplier to another. So an organization that had been leading the programming might not be able to receive fundings. That programming continued, but under the auspices of another provider who didn't necessarily already have that trusted relationship with the marginalized community. And I think that issue of trust sort of runs through so many parts of this conversation. To reach most marginalized communities, stigmatized communities, communities who are criminalized, communities who face extreme levels of violence, you really have to build that trust in it, and it takes a really long time. It takes community-based organizations like Grace's, like Annemarie's, working with the community and working with service providers, creating that bridge, creating that trusted platform. And it doesn't take much to disrupt that. And then to rebuild that, you know, takes huge investment. And again, oh gosh, I've just completely lost my train of thought. I'm so sorry. I've got it back. So I think one of the other things that we saw as a sort of very pernicious outcome of the global gag rule was not only a breakdown of trust in between service providers and marginalized communities, but a breakdown of trust within civil society in general. So, you know, partners that have been working together suddenly fearing to sort of talk openly about whether they're compliant or non-compliant, this fragmentation, this sense of danger, this sense of, you know, the chilling effect, which people have talked about extensively with regard to the global gag rule. And I think, you know, those are incredibly damaging impacts. Very difficult to measure, of course, in terms of sort of concrete outcomes, which makes it very difficult to kind of push back on them, because it's difficult to quantify things like trust and so on. But that sort of closing down of civil society space, which is something that the gag rule contributed to, but it's not, you know, we were already beginning to see the closing of civil society space, and we see it. You know, we see it for a number of different reasons: populist governments, backlash on LGBT rights, backlash on women's rights, pushback on SRHR. We're seeing it in a lot of spaces. So it's important to recognize that it's not all kind of contained in this sort of, you know, very damaging policy of the global gag rule itself. But you know, it goes beyond that. And then, you know, COVID comes in, and as Annemarie very eloquently described, sort of layers on top of that, you know, further closing down of civil society space, further undermining of people's human rights. And whenever you have that closing down of space, the backlash, the violation of rights, it's always the people who are most marginalized already who are going to feel the biggest impact of it. So we need to sort of reverse that, so that our efforts recognize that actually making the additional investment that it takes to reach the most marginalized communities actually has benefits for everyone. So, you know, really sort of turn that on its head. I'll stop. I'm going to stop talking now. I've put a resource in the chat, which is looking at some of the impacts of the COVID-19 pandemic on most marginalized, and just to very quickly highlight a couple of things. One is, what we really saw was it was both the number of human rights violations that went up during the pandemic and the nature. So you had a sort of double whammy of kind of more incidents of human rights, but also it's important to recognize that a lot of those violations, intimate partner violence, arbitrary arrests, all of those things, they already happened. It got worse during COVID-19. So again, you know, it's not all in the pandemic. We need to continue doing the work that we were already doing. But so the number and the nature of the types of violations that we were seeing. So some very specific, related to specific lockdown measures, and both the over-enforcement of lockdown measures on marginalized communities, and also the greater impact of those measures on marginalized communities because they were already economically marginalized, socially marginalized, and affected by violence. So it's a sort of multiplier effect. I'll also drop in the chat a report that we did, the report of the study that we did during the early implementation of the global gag rule as well, for anyone that's interested. Thank you.
Thank you. Thank you so much, Luisa, particularly for touching on some of those intangible effects of these policies and the way that the Trump administration has really choked public health and funding for foreign organizations. Would either Grace or Annemarie like to expand on that just a little bit? Do you have anything to add? I'd love to invite you to talk a little bit about how access to reproductive health care worsened in the communities you serve as a result of the barriers imposed by the Trump administration.
Okay. First, I want to encourage all of us in the participants list and on this panel, and let you know that alt-right people are everywhere. They're like a global pandemic. Okay, our alt-right people at the Kenya Christian Professional Forums, comprising of staunch Catholic men who are pro-life, homophobic, and transphobic, and hate any kind of marginalized group that feel should not even exist. Okay, so these agitators have been stumbling blocks in all matters SRHR for the soldiers' citizenry. Okay, and so all I want to say is that when folk in the US feel like the alt-right people are the worst of the worst, we have it too here. Okay, because these people are so entrenched in religious doctrine and tenets that are so biased and steeped in hate. And they do nothing but control and lobby hateful legislature, okay? And they make it more and more difficult for us to access SRHR services. And they make us look like we are poison and we infect other Kenyans with our, I don't know, they call us sodomites and adulterers. So I think the one thing that I can always say is that it doesn't matter what continent you come from, you will always have these kinds of people agitating for this level of cruelty. Okay, these are the same people that were responders in our Repeal 162 case, because the National Gay and Lesbian Human Rights Commission went to court challenging the constitutionality of the discriminatory penal code that criminalizes homosexual conduct. Yeah, and these are the same people who joined with the state against us. Okay, so I just want to say that these are the very same people who have refused to have us introduce proper sex education in schools, because we have very many young girls who have been molested and they are giving back every day. And the people who are molesting them are pedophiles, they're their headmasters or older male relatives or sickos from the neighborhood. And these are children not of majority age. And now there's a time like in 2018, we had so many pregnant school-going children between the ages of 13, actually, no, 10 and 17, right? Who got them pregnant. And we cannot pass even one single bit of legislation to get sex ed into these schools because, oh, it's taboo. We refuse to talk about sex to our children. It's taboo, it's un-African. This is not the kinds of things we do, but look, our children are getting molested, they're getting impregnated, okay? And then further, let's look at what happens to women as a whole. I'll have you guys know that we won a very major case the other day. Actually, it was yesterday. Yesterday was Friday, yes. We won the war against female genital mutilation, okay? So female genital mutilation is finally banned in Kenya, and it's actually a law, okay? So that in itself makes us feel really good, because this is what happens to us. And FGM happens to children, to girl children. That they get taken to the villages for this level of mutilation. So I just want to say that evil doesn't have to lurk in the bushes. It is exactly where we see it, right in the open. And I just want to say that I can't thank this forum enough for giving people like me and Grace this forum to come and speak as to what it is that we are facing with Trump, because there's still the ripple effect. Biden still has to clean up his stuff, but at least some of our clinics are opening. We can take our pregnant LBQ, GNC folk for prenatal and postnatal care. We're hoping to see less and less maternal and infant deaths because these clinics were closed. We're hoping to see less and safe abortions, right? Because most of our women, girls and women died, so many of them from unsafe abortions, because our clinics were closed. And that meant that all the staff, all the medical staff that we sensitized over the years had to be let go. So if they rehire, we have to start all over again with sensitization and advocacy. But we don't hire because our work is thankless, because we work for the community. We are the community, and we don't have the luxury of shame. We don't. We have to continue to agitate in these very spaces that we occupy and continue to show these people that these lived realities are not to be rubbished. Thank you very much.
Thank you, Annemarie. And Grace, I also want to give you the opportunity to respond.
Okay, so just to add on to what all the panelists said is the fact that the global gag rule has been very harsh to, let me say, to sex workers, because as communities we have seen it, because the biggest funding for sex workers comes from the USAID funding. And there is a report that was done by AIDS Funds that is called Fast Track that showed that 3% of the money that is given globally to do the money that is given globally for HIV response, only 3% of that money goes to key population. So it is very sad that only 3% goes to the population that people say it's key. And so the smallest percentage goes to the key population. So that is one of the issue. And then the fact that the highest percentage of this money is the US government money. It's gagged. This is the Anti-Prostitutional Pledge. And this money is expected to benefit us. So one hand is giving you, the other hand is taking away from you. And why I'm saying this is because I had talked about the segregation of healthcare. And we have seen that the healthcare facilities that offer services to sex workers, they are only comfortable giving us services that are HIV and STIs. But when you have another issue, you have been beaten by a client, you have been arrested, they will not address that. Why? Because of the gag rule. Because they are not ready to advocate for the rights of sex workers. And I also want to say this, we have seen a lot of illegal abortions. A lot of illegal abortion because of the gag rule. When you go to the clinic and you have an illegal abortion, the clinic will tell you, no, we don't do that because our money is gagged. The Anti-Prostitutional Pledge. So what are we really saying about, I would say the world has really normalized hate. I don't know whether that's the word to use, because it's not right when you go to a healthcare facility and you don't get all the services. So why do we offer services that are not a one-stop shop? Because there's no need for me to go get HIV and STI treatment. And my biggest issue as a sex worker is the criminalization. Criminalization is the biggest thing that we as key population are facing. Nobody wants to talk about our rights. Nobody wants to know about our existence. Nobody wants to know how we exist. But one thing I want to say is we as the community have continued to exist. We are continuing to build resilience to even exist in instances where we are hated, we don't want to be seen. And so I think even the work that we continue to do as communities, holding each other hands and also being together is very important. And also I want to say that when you look at this funding, the gag rule, the PEPFAR funding, it's gagged. Our well-being as sex workers, we face a lot of violence. I want to say, as a female sex worker, an active sex worker, the violence out there is so high. And I can't count the times that I have faced violence as a sex worker, because there are many times that I have faced violence. Even like yesterday, I almost got into a fight with a client. But one of the things I want to say is we need to advocate. We need to see people joining us hands, because how do we advocate for labor rights of sex workers? Sex work is work. We are globally, there is a campaign about decent work. our work, we want it to be put as a decent work. How do we join these campaigns as sex workers? How do we continue to ensure that sex workers' issues, sex workers' rights are upheld? How do we continue to safeguard the rights of sex workers? Once I'm in the brothel, I don't see a reason why somebody should come shooting me or should come harassing me because I'm working. So, and these things, it's the ripple effect of the global gag rule, because people have continued to entertain this nonsense of somebody can give you treatment and not look at your rights. And your rights are the most important things, because we struggle every day with lived realities. Your community members don't want to see you. Your parents don't want to see you. When you go on the street, the police is there harassing you. The next day you go to the healthcare facility, the healthcare provider doesn't want to see you, will start abusing you and telling you that yesterday you were here with the same STI, again you want condom. So we exist with this violence within us, but how do we address these issues? There's a lot of stigma, discrimination, and the fact that sex workers' rights are human rights. How do we ensure that these rights are going to be put at the center of everything? And the mental health of sex workers is very important. I want to say that because all of us are sex workers. I would say 70% of the sex workers have faced violence one way or another. A lot of 70% of key population have faced violence. We also struggle with issues of hate, issues of communities not wanting to see us, issues of rejection, even by the family members. By the end of the day, we don't get mental health. How can people support us? How can we be able to lobby for this gag rule, maybe to be removed, the Anti-Prostitutional Pledge, so that we can be able to access even mental health services for us sex workers? Yeah.
Wow, thank you so much, Grace. Just everything that you're saying and everything that you're bringing to our attention is so important, and I really am grateful for all of your perspective and all of your experience that you're sharing with us. I have another question for everyone, and then we're going to open up questions to the audience. And I'd like to know, sort of in light of what you were just speaking on, how can folks on this call best use what they've learned here today to advocate for reproductive health care and rights of the LGBTQ plus community and sex workers?
Okay. I would say that basically GGR since 1984 has always been dependent upon who is in office in the US, sadly. And as someone, as a queer woman living in Kenya, my hope is that this goes to Congress, and so that it is not determined by executive order ever again. Because we are safe now with Biden, who knows what will happen after 4 years. If he remains as president, if he goes, then we get somebody else, and once again, GGR comes into effect. So we are really hoping that you as Americans actually push for this to actually go to Congress, so that it can just be something that will never be taken away or brought back, rather, by the stroke of a president's pen. I think that's my biggest fear, for real. Yeah.
I think really the permanent repeal of the global gag rule. I don't know very much about the HER Act, but I mean, I'm following it. I'm encouraged to see that movement happening over there, and really praying that it will be passed. I think just to sort of add on to that, I really want to say, kind of listen to, work with the communities that are closest to the negative impacts of these policies. Funding conditionalities come in all shapes and forms, and they're not new. As we know, the Global Gag Rule, the Anti-Prostitution Pledge, they are not the only ones. So sort of going back to something Grace said very early on in the conversation, really sort of working with communities, respecting the integrity of the communities that we work with, respecting their knowledge to know what they need to be able to shape and implement that themselves, and creating the space for that to happen with the minimum of conditions attached to it, I think is just so important. Also, just to sort of touch on the fantastic news about the law outlawing female genital mutilation in Kenya. I mean, I'm thrilled to hear that, but we also know that there are protective laws, and they often fail to protect women and girls, LGBT community, sex workers. And so really kind of the monitoring of that law to make sure that it's implemented, that the government is held to account, needs to start straight away, doesn't it? We can't just say, great, that's a new law, that's done. Every step of the way, the government needs to be held to account on that commitment. Is it still happening? Where is it happening? How? Who's doing it? And what resources are there to really kind of bring that law to life on the ground, so that it's the positive impact of it can be felt. So I think I think those are sort of my main points.
Wonderful. And Grace, it looks like we've got about 2 minutes. Would you like to address that as well?
Yeah, so basically, I just want to add and say that I would like the guys on the call to help us push for gender equality, regardless of gender identity, gender, sexual orientation, and the work that we've chosen to do. I also want to talk about, we continue talking about decriminalization of sex work, of same-sex marriage, but how do we unpackage this conversation? What exactly does it entail? What are we talking about? So we are quick to say decriminalization, but it is different to different people. And how do we continue even pushing more? And maybe finally is resources and SRHR resources, education materials that are simple and understandable by the communities that we come from. So I haven't seen any materials that are friendly and simple to the communities that we come from. If this can, if people can help us push for that and see how do we continue educating our communities on importance of proper SRHR rights, and also finally political engagement. It is very important to see how do we engage politically so that people continue to know the existence of sex workers and LGBTI plus communities. Thank you.
Thank you so much. And I do want to acknowledge that we are at time, it is 2 o'clock, but if some of our panelists are willing to stay on to answer a few of the questions from the audience, I will also invite all of the attendees to stay on for a few minutes if you'd like to. And if you're able to, I'd like to address some of the questions from the audience. All right. So one question here is, are other countries helping with sexual health care, or are these countries relying primarily on the US? If anyone wants to answer that quickly, maybe Annemarie.
Okay. I'm happy to say that Luisa, you and I engaged sometime last week on the Global Transformative Approaches workshop. And I have to say that we have a lot of support from other countries through their Ministry of Foreign Affairs, and not just the US. So the GGR, yes, comes from the POTUS that's there at the time, but that doesn't mean that we don't have a lot of support from the US organizations that see us and appreciate our work and celebrate our work. And we have a lot of support from European countries like Finland, the Netherlands, the UK. So all of these allied partners, funding partners, are constantly celebrating us and supporting our work. And this is the reason why people like Grace and I are still here. And I see some of my colleagues as participants here. They're the reason why we are still here fighting the good fight. And maybe Luisa or Grace would like to say something.
I also want to add on the universal healthcare coverage that most of the African countries are working around. And I would say the government has the will, but the same government continue to criminalize key population and LGBTQI plus sex workers. So when it comes to being particular or adding issues of key population, it's very difficult, but we are trying to see how does our issue go to the universal healthcare coverage that governments, the African governments are pushing. And the penal code that exists, the criminal nature of sex work, it's very difficult, but we are lobbying at that level with the government to see that we can access UHC and also domestic funding in the different African countries.
Okay, I've got another question here. There are many barriers to accessing comprehensive health care, and there's a real lack of understanding or awareness of the differences in care for sex workers. How can we best address this issue, especially when folks are reluctant to voice their SR/HR needs for fear of cultural and/or community backlash?
Thanks for the question. I think one of the things, and I spoke earlier, is information, friendly information that targets sex workers. I also want to talk about putting communities at the center, and these needs of sex workers are known, but we've seen that when programs are being done, they're not being done with community needs. So having a comprehensive package that talks about SRHR needs of sex workers, and also holding donors or governments accountable when we have a comprehensive package and it's not delivered. Yeah.
All right, Grace, it looks like you are pretty popular. I've got one more question. Could you explain the Anti-Prostitution Pledge?
I will answer and then Luisa can also help. So the Anti-Prostitutional Pledge is where when you get PEPFAR funding and you have a contract, you'll have to, you sign on the contract that as you're implementing PEPFAR or USAID funding, you're not going to do any activities that is related to human rights or advocacy work in relation to sex workers. Yes, but Luisa can add more.
I don't think I can add more, actually, Grace, to be honest with you. I'd like to, but I think that's, I mean, I haven't worked with that policy in the same way that I have worked to really try and get to grips with the global gag rule and its impacts. But I think it's basically that it's you know, making that commitment, promise on receipt of US funding that you won't do any work that sort of promotes sex work. Similar to the global gag rule on abortion, but I don't know the ins and outs of the policy.
Well, thank you all so much for your time today, for all of your work, for all of your energy, your passion, and your knowledge. We really appreciate you taking the time to join us today. And thank you so much to everyone that has joined us for this panel discussion. It has been a fiery day, and I want to invite you all to join us tomorrow for the advocacy training. And yeah, thank you. Take this knowledge and use it, please. We need to put this into action. Thank you all so much.
Thank you so much. And can I just say, I've never seen a chat that's just been so fantastic and full of like enthusiasm and support. And so really lovely to be here. Thank you very much. And it's been such a pleasure, Grace and Annemarie, to be on a panel with you both, and you, Giovanna, of course.
Thank you so much. Yeah, the chat has been explosive and
just been fantastic.
It's matching the energy that you all are bringing, and
yeah.
it's an incredible panel. So we're excited to have you.
Thank you so much for having us.
Thank you,
Hey,
everyone.
Lauren, I see you.
Thank you.
Goodbye.
Bye, everyone.